7:45 is the time now. Louiselle Morris was 13 when she was told she had scoliosis. It's a painful curvature of the spine. She was urged to take painkillers to help her cope with the condition.
Well, within a year, she said she was addicted to taking morphine-like drugs on a daily basis to ease the pain.
Louiselle joins us now with Erika Maude, sat next to her, from Scoliosis SOS treatment centre, which helped Louiselle beat the condition, and Barbara Murray, who's a GP. Very good morning to everyone.
Morning.
Louiselle, if we can, we'll start with you. Tell us a little bit about the pain you were in and what was going on with the curvature of your spine.
The curve is 48 degrees, and it hurt a lot.
You're in a great deal of pain, and I think maybe the best way to illustrate your condition is if we have a look at the X-ray and people get a sense. We can see, obviously, from your neck going down, and it extraordinary
and it
shape of
affects
your
the
spine
whole
there.
body there.
And give us an idea of the pain you were in. I mean, was
very muscular. You can't really pinpoint it as well. So it's a...
So when you were quite young, you started taking painkillers, didn't you?
14.
And you became addicted to them?
I was left on them. I got lost in the big hole of NHS admin, really.
Yeah.
And because the traditional way of dealing with scoliosis focuses on the vertebrae rather than the whole body, it ended up... They couldn't find the cause because the cause wasn't in the vertebrae, it was more muscular and in the ribs.
So what was the turning point for you?
I turned on BBC Breakfast with my mother and I saw Erika on here promoting the clinic.
Okay.
And that's how we found out about an alternative method, because I wasn't a candidate for surgery at the time.
So you've managed to help her, and
yes, that's right.
I mean, not only just dealing with the pain, but get off the painkillers as well.
Yes,
How?
and well, basically, a lot of not everybody with scoliosis does suffer pain, but a large proportion of the population that do have scoliosis do suffer pain, and a large part of the time that's due to this muscular imbalance that's going on in the spine. So one side of the back, the muscles are working very, very hard, and on the other side, they're not working very hard at all. And that's what was going on in Louiselle's spine, where you've got that massive curve that we just saw. So we've been working with her to strengthen the muscles up in her spine to be able to realign that spinal balance to get her spine more centrally aligned.
I know you've done really well, Louiselle, but coming off those painkillers was pretty tough for you. Just tell us what it was like, would you?
Your body's basically turning on you, so it's a whole body, every single fibre of you is on fire.
And how many painkillers were you taking? What sort of thing?
4 tramadol and 8 paracetamol a day.
Gosh, which is... Let's talk to Barbara.
Yeah,
That sounds like a lot.
Well, yes, but it's actually quite within the limits of acceptability for chronic and intractable pain.
Right.
It's not an excessive amount. I suppose the paracetamol is the full amount that you would expect to take in a day.
But I suppose that the point here in relation to the condition is what you're doing is you're treating the pain, but you're not treating the condition.
Yes, absolutely. And the difficulty is that, you know, it's not acceptable for a 14-year-old young lady to be dependent on painkillers in that way, and particularly dependence-forming painkillers, which is tramadol is an opioid form of painkiller. I suppose if we had alternatives readily available, then that would be the best approach. Often we're presented with people with chronic back pain, for example. That's a major cause. People come into the surgery in total agony. They're worried about losing their job if they're older. Certainly with a young person, it's difficult to understand why she was left in that situation, you know, requiring the painkillers every day without somebody addressing the matter. We are responsible, I think, in a lot of cases for not monitoring people who are on long-term painkillers and helping them to reduce.
Erika, is it something you see quite a bit when people present themselves?
Yes, it is. A lot of our patients at Scoliosis SOS are very much kind of reliant on pain medication to actually help them get through their daily lives and actually give them a quality of life. And obviously the problem with taking painkillers, although it sort of, you know, masks the symptoms of pain, it's actually not actually treating the underlying cause of the scoliosis. So it's not actually kind of addressing the root of the problem.
And you know, Louiselle, you were saying how you saw something by coincidence on this programme. I mean, there are going to be people watching now who are suffering
that's
from
why I'm
back pain,
here.
you know, who will be thinking, how are you now?
I'm fine. Everyone gets aches and pains, and perhaps I'm probably more aware if I get an ache or pain in my back, but it's nowhere near as bad as it used to be.
And are you
now
taking painkillers now or not?
nothing. I haven't taken anything in years.
Really?
I focus on healthier alternatives to dealing with pain. So
That's a brilliant idea. Thank you very much. Thank you all for joining
Thank
us.
you, Barbara. Thank
Thanks,
you as
Barbara.
well.